Thank you very much, Avery. With that, also the chat feature has been turned off so that we capture all discussion as part of the recorded meeting. And to make this meeting run smoothly, any questions should be directed toward the co-chairs or grant staff, such as myself. My name is Casey Beck, and I am a grant program coordinator here at the Criminal Justice Commission. Today, we will be presenting a summary of IMPACT's Q4 data, an agreement amendment request that will require action from this grant review committee, several updates from the Oregon Health Authority, Oregon Health and Science University, Portland State University School of Public Health, Oregon Health and Science University Center for Health Systems Effectiveness, as well as begin discussion around future impacts funding. Today's anticipated meeting schedule is shown here, and please note that all times are generous estimates. Before we take roll, I did want to inform folks that Jaron Riddle has taken a position on a different committee and has resigned from his position as a member of this GRC. But I wanted to take a moment and acknowledge Jaron's invaluable contributions to impacts as a whole, as well as to thank him for all of his efforts in being an active member in this Impacts GRC for the past 4 years. So it's quite wonderful having him here. We're going to miss him, but we wish him all the best on his next endeavor. Let's see, we will now pause to take roll. Okay. Co-chair Sam Byers, are you here?
Good morning, I'm here.
Thank you. Co-chair Sandgren.
Good morning, present.
Jeremiah Stromberg.
Good morning.
Morning. Judge Shanti. Right, Liz Weber.
Good morning, present.
Good morning, Liz. Steve Gunnels.
Good morning, present.
Thank you, Steve. Eric Swallow. Chief Harden. Commissioner Hall.
Present.
Thanks, Commissioner. Alicia Beamer. Stacy Brubaker, are you still with us on the phone?
Present. Thank you.
Thank you. Dr. Brigham.
Present.
Sheriff Landers.
Good morning, I'm present.
Good morning. Dr. Stanfill. Great. Senator Gelson-Bluen. Janie Gullickson.
Good morning, I'm here.
Good morning, Janie. All right, and that is it. And I believe we have quorum. I'm looking for Avery to confirm that.
Yes, we have quorum.
Thank you very much. All right, let's get this going. So we have a couple of small updates to share with you all since we last met in May. First, our CJC Impacts team and many members of our Impacts grantee teams met in Seaside at the end of May to attend the 2023 Northwest Regional Crisis Intervention Training Conference, as well as the Impacts Grantee Retreat. The two-day conference really centered around crisis intervention, skill building, sharing and learning best practices, and networking with colleagues in both the behavioral health field and the criminal justice system from across Oregon, Idaho, and Washington State, so the entire Northwest region. As part of the conference, our wonderful research partner at OHSU, Sarah Rayner, moderated 2 impacts panels in which grantees shared about their programs with stakeholders and peers. The Impacts Grantee Retreat was a half-day event with participation from 27 grantee representatives from 13 of the 15 impact sites. The CJC, the Waddell Research Group from OHSU, and 2 representatives from the governor's office were also in attendance. The half-day impacts retreat featured a detailed training on the rollout of data reporting updates, as well as an opportunity for grantees to connect in person, share best practices, discuss any challenges that folks were facing. In my personal opinion, it was an absolute amazing opportunity to learn and connect in this capacity. And I really hope to have another opportunity to do so in the future. Second, as you may have heard, at the close of this most recent legislative session, an additional $10 million was appropriated to the Impacts Grant. And that is unexpected and amazing news. And lastly, the Research Electronic Data Capture Database, which thank goodness has an acronym, we call it REDCap, went live on July 1st, and grantees are now reporting de-identified client-level data. Both our researcher, Will, and the team from OHSU, PSU School of Public Health will go into more detail shortly about what this means for impacts data reporting moving forward. I will now turn it over to Zach Thornhill to share some legislative updates from OHA. Zach, are you here? There you are. Wonderful.
I am
I'm going to
here.
stop
I'm not-
sharing.
Do you not have the slides up for
Oh.
us?
I can absolutely do so. Yeah, 1 second here.
Oh, I thought they would be in the slide deck. And I think actually Sam Byers is going to just review these with you all this morning.
Sounds great. All right, hopefully everyone is now seeing an OHA presentation. Okay, great, seeing some nods. Thank you so much. Sam, let me know when you would like me to advance slides.
Yeah, go ahead and advance the slides. I know Zach and I are tag teaming here. So OHA behavioral health investments are just starting to settle. You know, I think we all know after legislative session, there's this moment in time where we're trying to figure out what we did get, what we didn't get, and where it all belongs. So what we have right now is Senate Bill 5525. It's OHA's budget bill. We have $15 million to increase SUD treatment beds. And I just want to say $15 million to create residential or withdrawal management is not very much funding. My apologies, I'm not on camera. I meant to be there. It's not a lot of funding in order to build new structures, but we do anticipate that that money will go towards existing treatment providers who want to expand their capacity, or in some cases, there have been build outs that have happened with Measure 110 or other funding that some of the money can be contributed to. $7 million has been allotted to the CMHPs for a civil commitment, and Zach can go into detail there. I think we're still working on what that will look like and how that money will be distributed. And then there's $6 million that's specifically focused on transitioning individuals out of OSH, particularly those vulnerable to houselessness. Then we have some general fund allocation, $50 million for changes in caseload level, $50 million to develop psychiatric care settings outside of OSH and hospital systems. So trying to find ways to alleviate the pressure that's happening in those settings. And then another $6.6 million for jail diversion and civil commitment. Next slide. And then Senate Bill 2757, I just chuckle because I'm deeply involved in this one, establishes the 988 Trust Fund. It's really the build out of the 988 crisis call centers. There's some indication that we'll be able to utilize some of the funding for crisis stabilization centers, respite services, including peer respite, and behavioral health urgent care. So these dollars in particular, we're still sorting out in terms of legislative intent and how it will come to us. There's some tax revenue that we received, but then there's also some specific positions that are coming our way to build out both the I think workflow between the call centers and the mobile crisis teams, which are CMHPs or any other entity that's interested in participating. And then also figuring out how we can begin to fund the crisis stabilization centers so that once there is a crisis call and they need people to respond, rather than having folks end up in the hospitals or jail systems, they have a place to go to be cared for by clinical teams. Next slide.
That actually was the end of the
I
ones
think that's
I
it.
had.
Yeah.
Yep,
That's
okay.
the one that I thought.
Thank you, Sam. Does anyone have any questions? All right. And Will, can I get a nod if you see we're back into our PowerPoint? Okay, thank you. Navigating screens. You think after 3 years it'd be just easy peasy, but it's still kind of challenging. All right. So now I'm actually going to turn it over to Will, and he is going to provide an update on quarterly data from grantees for the most recent quarter, which was April through the end of June of this year, 2023.
Good morning, everyone. Thank you again for joining us so early in the morning. My name is William Ash Halchin. You can call me Will. I'm the research analyst for the Impacts Grant. And as you may have grown accustomed to, if you've attended these meetings before, I have 4 tables to show you. The first looks at demographic characteristics of the client served in the most recent quarter. Then we will look at the aggregated diagnoses that we receive from local programs. Then we'll turn our attention to the needs and services provided by local programs, and finally, connections to care and diversion services. But first, I want to draw your attention here to Table 1, which is on your screen. At the very bottom, though, the very first thing I want you to notice is that we did have a very slight decline in the total number of clients served from Q3 to Q4. That declined from 450 to about 432. And so that can really affect some of the percentages that you see on the rest of the table. So I wanted to mention that here in the very beginning. So if we come back to the top of the table and we look at the race identification categories, what we see is that there has been a slight increase in the proportion or percentage of clients who identify as white from about 55 to 62 in the most recent quarter. Not a lot of movement in terms of those who identify as Black or African American or Latinx or Asian and Pacific Islander, but we also did see a slight decline in those who identify as American Indian from about 25% in Q3 to about 21% in Q4, so a slight reduction there. And then we also see that the number of unspecified racial identification is actually lower. It was about 12% last quarter, and that's been reduced to just over 8% in the most recent quarter. And so I'll turn next to age, the very next thing in the table. And so what we see is that there is a slight increase in those in the youngest category, those who are 18 to 24. But then we see a decline in that sort of young adulthood category of age 25 to about 34, which is usually a very common category. It's declined from about 35% just down to about 33, 34%. We also see an increase, however, in that sort of adulthood, 35 to 44-year age range, from about 28% in Q3 to about 31.33% in Q4. And then as we continue down the age categories here, I just want to draw your attention to the fact that there have been some declines in the number of participants who are older or further into adulthood. That 45 to 54-year range has declined about 4 percentage points. And then those, the next category, 55 to 64, has declined about 2 percentage points. And then interestingly, we do see some movement in the opposite direction for the highest category, those whose age is 65 years or older. That has trended about 1%, but it's over 4% in this most recent quarter. And so as we transition to gender, although the numbers change, the proportions or the percentage breakdown is still roughly similar. We still see about 2/3 of the clients are male. We still see that just under 1/3 of the clients identify as female. And we see that about 1%, between 0 and 1% of clients identify as non-binary. And so as we move down to disability status, not a lot of movement in terms of physical disability from quarter to quarter. Here it's one additional client, so that barely changes our percentage. But I do want to note that here in developmental disability, this is an item that we internally at the CJC are looking at more closely. We have a couple of local programs that are reporting higher percentages than their colleagues at other programs. And we want to make sure, for example, is this being diagnosed directly? Is this something that could be derived from other data items, maybe in an electronic health record? And so we are reaching out to a couple of our local programs just to make sure that we understand how this item of developmental disability is being reported so that we can accurately reflect that when we speak to the grant review committee. So you may see this number change at the November meeting, and if it does, I'll make sure and explain that in great detail. But here for this quarter, roughly 25%, 1/4 of clients were flagged by the local program as having a developmental disability. And so the last item here on this table sort of corresponds to what we looked at the very beginning with race. We see a decline in the percentage of those who are affiliated with a tribe, about 24% in Q3, and then that's reduced slightly to about 22% in the most recent quarter. Next slide, please, Casey. Thank you. And so here on table 2, what you have are the aggregated diagnostic groupings of the diagnosis that we get from local programs. So just as a refresher, each local program reports to us their top 3 diagnoses and the number or frequency of clients who have that diagnosis. And of course, clients can have, those diagnoses can change, they can change over time. And so this is just a way for us to better understand what is going on with the clients in local programs. But those diagnoses come to us in a lot of ways. They can come to us sort of exported from an EHR, which will give us like ICD-10 codes. Sometimes we get ICD-10 codes and words associated, and sometimes we simply get one word like anxiety or depression. And so these come to us in a lot of ways, and it can be challenging to sort of parse those in a way that's meaningful and makes sense to present. And so what we are very grateful for is our research partners at the OHSU PSU School of Public Health for providing us with these diagnostic groups from SAMHSA that allow us to sort of take all of those diagnoses and funnel them into a sort of digestible and understandable set of categories here. So I'll just talk about the ones that have had some movement. We don't see, for example, a lot of movement in the alcohol use disorder, very, very slight decline in diagnoses, as well as anxiety disorder, slight decline, and bipolar disorder, it's just slightly fewer diagnoses there. But what we do also see is an increase in the number of depressive disorder diagnoses from Q3 into Q4. And we also see an interesting pattern here with trauma and stressor-related disorders, as well as schizophrenia and other psychotic disorders, which is on the second half of the table. And what we see is that the trauma and stressor-related disorders, about 20 people additional receive that diagnosis from Q3 into Q4. And we also see that there's a sort of similar decline. Uh-oh, Casey, I think we lost, there we go. A very slight decline in that schizophrenia or schizoaffective disorder diagnostic group. Finally, we don't see that much movement in methamphetamine use disorder, but we do see a lot of change here with this other substance use disorder category. So there's a very large increase here from 38 in Q3 to about 87 in Q4. But this includes all of those diagnoses that simply came to us as substance use disorder. If we were able to tell, for example, that it was related to amphetamine use or stimulant use, then we were able to better classify that, or for example, opiates. But if it came in just as substance use disorder, that's how we classified it here in the bottom of the table at the other substance use category. And then the very last thing on this table discusses dual diagnosis among clients. And this is when a client has both mental health and a substance use disorder. And y'all forgive me, it's still pretty early in the morning. So 184 is a slight decline, but that is about 43% of clients. So just under half in the last quarter, it was right at half of clients continue to have a dual diagnosis. Next slide, please, Casey. Thank you. So table 3 here talks about the specific needs of the clients in local programs, and then the number and percentage of that need served by those local programs. And so again, I want us to remember that the number of clients did decrease. And so this table in particular is sensitive to changes in the number of clients because both the number who need and the number who are served contribute to that percentage. So we may see some big changes with the percentages, but just keep in mind that that could be affected by the number of cases. And I think mental health gives us a good example to look at. And so what we see from Q3 into Q4 is that the number of clients who had a mental health treatment need, that was reduced. And so was the number of people who were served, but we see an increase in the percentage. And that is because the need decreased more than the number served. So they both declined, but one declined more. And so we were able to see a greater percentage of that need met in Q4 versus Q3. And then here in substance use treatment, which is the second one in the table, we see again a decline in need, but not a lot of change in the number served. And so this kind of makes sense, right? Why we would see it goes from 55% of that need served in Q3 to about 2/3 or 67% of that need served in Q4. And then if we look at peer mentoring, the need only declined slightly here. And the number served, again, just very slight decline from Q3 into Q4. So about 70% of that need was met in terms of peer mentoring in the most recent quarter. I think with reentry and employment in particular, although they do vary slightly, I think these could be classified as success stories. So with reentry, we see that the need increased, and we also see that the number served also increased. And so whereas before, in Q3, about 38% of that reentry services need was met, it's at 50% here in the most recent quarter. And similarly, although the need did decline with employment services, the number served increased again. And so roughly a quarter of that need was met in Q3, but here we're just under 50% of the employment services need being met in Q4. And then the last items here are sort of related to one another. They both relate to housing. So that's why the need is the same for both of them, because the person needs housing. But it is absolutely possible for, in the course of 3 months, an individual to receive a transitional housing placement, maybe in week 2 of the first month. And then by the time we get to the end of the second month, at the beginning of the third month of the quarter, that person could receive a more permanent supportive housing placement. And so we measure these separately just to make sure we don't inadvertently double count individuals who receive housing services. And so what we see broadly from Q3 to Q4 is a slight decline in the number who need housing. And while we saw a slight decline in the permanent housing, we really did see an increase in transitional housing placements. And so from about 1/3 of the need being served in Q3 with transitional housing placement, it's about half, 48% in the most recent quarter. And then that percentage of housing needs met with permanent housing remains the same at just under 30%. So next slide, please, Casey. Thank you. And then the very last table that I have to share with you today discusses both connections to care and diversion services. And we'll start with connections to care. And so critically important is the Oregon Health Plan eligibility screenings that clients frequently receive in local programs. That did decline slightly, as did the number of total clients served in the most recent quarter. But I think another thing we can celebrate as a success is this increase in the number of people who were assisted with Oregon Health Plan enrollment. And so that increased from about 40 folks in Q3 to about 66 folks in Q4. So more people being helped to sign up for Oregon Health Plan. And then case management is a critically important and common service provided by local programs to clients. About 230, which is, again, a slight decline, but we have slightly fewer clients to serve in this last quarter. But this is still just about half. I think it's 50, again, real early for head math, 51-ish% of clients are receiving case management services each quarter. And then finally, we have diversion services. And so these can be tricky. This first one, criminal justice diversions, is referring to people. So these are people who are diverted. And we see that has increased from Q3 to Q4 from 85 to about 92. And then community hospital diversion services is not necessarily tied like one person was diverted. It's more about the services provided to folks in that setting to prevent their reuse or increased use of that service setting. And so what we see is another increase, about 927 in Q3 to over 1,000, 1,147 services provided in the most recent quarter. And here, this very last item on the table, discusses the number of times that a local impact staff member assists law enforcement with either an impacts client or someone who's at high risk. And so again, we see an increase here. Just all of these diversion services, we've seen at least a slight increase in the number of services from Q3 into Q4. And so I do want to mention first, are there any questions about any of this so far?
Looks like there's a question from Stacy Brubaker.
Yes,
Hey.
of course.
Good morning. I just wondered if anybody reports or if we've ever asked about how many folks involved in the impacts programs are aid and assist versus not aid and assist. Do we ask that at all?
That is not something that was reported to us in the aggregate, but I do believe that there are some indicators of that in the REDCap reporting system, which has rolled out here in July. And so I don't know that we've had our eye cast on that in the past, but I do believe that we will have at least some capacity to look at this in future.
Okay. The other question I had is, do we know how many folks, I mean, this is probably too related to the aid and assist, and I might be getting into the weeds here, but I wonder if there's a way to track how many of those folks that are actually involved with aid and assist are actually found to not be able or never able, because I know down here we run into that quite a bit. I would be curious to see how many of these folks, if any, that the impacts grants are currently serving are not just involved with aid and assist, but are involved with aid and assist. And then once they've gone through the restoration process or through through the Oregon State Hospital, are they still found not able? Because I wonder if there's a correlation between the number of increases of folks that are in the disabled developmental disabilities category, because many of those are found never able. And then that really creates a whole nother pool of different types of resources and services we have to put in. So I was just curious about whether that's anything we've looked at or if that's something we could look at, especially since there seems to be an incline on the number of folks with developmental disabilities that are involved.
Thank you. That's just deeply fascinating, right? That's right up my alley. That's something that I want to look at. I don't know that we've looked at this in the past. I'm not sure that we've had perhaps the right data to do so. And I don't know to what extent we'll be able to in the future, but certainly it's something that I'm glad to take and investigate and see whether we can use some of the data that we have or some of the data that we're not collecting to better answer that question or to drill down into that population a bit more.
Yeah, and to maybe help figure out some strategies of how we address those issues. Okay, thanks.
I'm curious, Sam or Zach from OHA, do you two have any thoughts on if that type of data is tracked through any of your aid and assist programs?
Yeah, I mean, we definitely collect data on aid and assist programs, and we are looking at sort of those new transitions, considering the Mossman orders. And we do have a collaboration with our ODDS partners for those with intellectual and developmental disabilities. So I think we definitely have the data to be able to explore that and try to find some answers that you're looking for. So Will, I'm happy to meet with you and figure that out together.
Yeah, and again, mine was really related specifically to the impacts folks. But yeah, I mean, across the state, that's certainly an interesting question as well.
I'm sorry, I didn't hear that.
I was just saying that yes, I think that's an interesting question across the state, but I was also wanting to see if there was a way to specifically get at that for those folks who are part of the impacts grant.
Yeah, so I mean, we could look at it across the state with the 16 grantees, but I think we'd have to have person level data, and I think that'd probably be kept with you all, but we could then, you know what, I'm sure we could probably figure something out. I'm just not, I'm not the data person to know that,
great.
But
I just wanted to flag it because it does seem to be a pattern.
Yeah, no, that's a great thing to do. We'll look into it.
Thank you. All right, y'all, are there any other questions about Q4 reporting for me? No. Okay,
This is Janie. This is Janie. I can't find my
hand raise feature, and I don't know if it's because I logged in as a guest anyway, but I'm just curious. Thank you for sharing all the data, and I'm still trying to, in my mind, put together a story of what all that data means, and what are some outcomes from this. If I'm asking this question too early, happy to look forward to hearing more about that. But for example, the decrease in diagnosis or need or increase in peer mentorship and needs served, what does that mean exactly? Sorry if I'm missing the obvious.
No, that's perfectly okay. I think that we are looking at outcomes in a number of ways. We, of course, have a statewide outcome, which we will hear about, a statewide evaluation, which we'll hear about a little bit later, which would incorporate some of that. I'm not sure that, I think these in this particular case may be more of the outcome. This is like this at the time was an aggregate look over time for the grant review committee, but we do, now that we've implemented individual level data collection, I think we'll be able to answer more questions than we were previously. For example, just with the diagnosis codes, we only get 3 from each local program, but there could be many more, and they could have some clients whose diagnoses never once showed up in our reporting because they were rarer. And so I think we'll be able to see a lot more with the individual level reporting than we have before. And then also at a very broad level, we do have evaluations looking at these outcomes at the state level, or sort of areas where impacts was versus areas where impacts was not. Is that helpful?
That was such a good question, Janie. And I honestly think that you actually might be a CJC employee because you just helped us with our amazing transition to talk about outcomes and the future of data. I would say hang tight. Let's listen to Sarah a bit about the future of reporting, and then we can circle back to those questions.
Thank you.
Will, do you have anything else before I move forward?
Nope, nothing else for me. Thank you, Casey.
All right, so before we wrap up this update on grantee reporting, we're going to invite Sarah Rayner from the Waddell Research Group at OHSU PSU School of Public Health to update us all on the recent rollout of the REDCap database and what we're able to expect for the future of grantee reporting, what kind of outputs we're capturing, what kind of outcomes we're hoping to look at. Sarah, do you want to attempt to share your screen, or would you prefer that I throw up the slides? I have no preference.
Yeah, I am going to try to share my screen and take over. How does that look?
I can see it. Looks great.
Wonderful. Okay, good morning, everyone. Actually, before I start, it looks like Stacy might have her hand up. Actually, a bunch of hands went up. Okay, I think I'm having a malfunction. Hi, good morning. My name is Sarah Rayner. I'm a research project manager at the OHSU PSU School of Public Health. Thank you for having me here today, CJC. I'm going to share a very quick preview of the new Impacts REDCap database, which, as Will and Casey both alluded to, this is going to be the new source of grantee reporting moving forward. So those tables that Will walked through, that is from past reporting structure. As of July 1, we have a new system that grantees are using. Okay, so our team at the School of Public Health has spent the last many months connecting with grantees to better understand what services are being provided across all the sites, what data points are available across all of the sites to help inform the development of a shared database for impacts reporting. We have piloted, tested, revised. We continue to monitor and adjust this database based on direct input from the grantees since the go live date, which again was July 1st of this year. So some key changes that we just wanted to call attention to what has changed between that previous reporting structure, the tables that you've been seeing at these grant review committee meetings, and what the new database will bring include a shift away from quarterly aggregate reporting to a live database. This live database is where client level data will be collected and stored, and our team will pull, organize, synthesize, and report that back to CJC on a monthly basis. The new structure that's been developed is really designed to increase our collective understanding of eligibility criteria, who's being served, client needs, the scope of services being provided, the resolution of client needs, and client engagement over time, which hopefully touches on what Jamie had just asked about outcomes. So I'm going to see if this works. I put a little video clip in the slides. I wanted to show a preview of the user interface. So this is what the grantees actually see on their end. And this is an example of the baseline form. This information that I'm going to hit play, I'm just kind of trying to narrate through and see if I did it too quickly, or this will set a starting point when a client first connects with or engages with impact services. And then we can get monthly updates over time as that client continues to engage with services. This is maybe a little bit small on your screen, and it, again, will be pretty quick, but I'm happy to share a PDF of these tools with anyone who's interested from the GRC. If you want to review this at a slower pace, at your own pace. So I've hit play. This is how we'll be able to track individual level information. What you can see is that we'll have that first date of engagement, which is really exciting to have, so we can track over time. I'm actually going to pause really quickly. I wasn't going to do this, but how did you identify and connect with the client? This is not a required question. Some are required, some are optional, which gives us that chance to really dig deeper. And to state, I think, Stacy's question about aid and assist, this could be a point where we add in a question, perhaps, is a referral pathway coming directly from aid and assist here. So I just wanted to call attention to that. We can update these fields. We're trying to avoid that for the first couple of months as we get set up, but we will be taking a look at whether outcomes are being tracked efficiently here. Demographics, similar questions, really matched up with what we already are asking and what Will just went over. If you hit yes, example here, disability, it does prompt to dig a little bit deeper into some questions with skip logic. Mental health and substance use are really, really important for us to track over time. It'll be nice to be able to see that based on individual level information and having that client to client rather than just an aggregate number reported of how many people are experiencing this. Substance use disorder, again, then we can also track as dual diagnosis or co-occurring disorders, which is super important. This we are really, really excited about. This is what we're calling our encounter matrix. This is included because it's something that kind of fell off of reporting as grantees went through 2020, 2021, trying to get their programs set up at the most difficult time that we've seen, just unprecedented challenges. And so we're able to add this back in because we know that grantees are defining high utilizer in different ways, depending on their program structure and where their program operates from. So we've included, based on conversations with grantees, all of these sorts of services so we can track whether individuals are having encounters. This baseline looks at the last year to really set that precedent of why is this person considered a high utilizer? Here, this example, yes, they had an encounter with prison one time in the last year, 4 emergency departments in the last visits in the last year. Housing, living arrangements, employment status, these are all outcomes that we hope to see movement on based on what we've heard from grantees and what they're hoping to see and support their clients with. In addition to those, sorry, this is so fast, we pulled out diversion services because we know how important that is. These are the core pieces of the original impacts legislation: diversion from jail, emergency department, Oregon State Hospital. So at this point of baseline, we're asking, was this identified as a client need? Were services provided, and was that need resolved? And we pulled out these, obviously, because the legislation really does emphasize these emergency services. And here we have case management and peer support pulled out, because these are also just key strategies that the grantees are using across sites, across every single site to meet client need. And then we have a whole gamut of other services. So that was very, very, very quick. Again, I am happy to share a PDF of the baseline tool and the monthly updates. A lot of this information we're going to be able to just have a repeating form. So we'll have that information looking back at the last year, and then we'll have that information moving forward if that client continues to engage in services for each month, which is really exciting and a huge shift for impacts reporting. Okay, let me catch my breath here. So in that very quick video preview, you probably did not notice, but at the top of the REDCap platform page, it says supported non-research project. What this means is that although REDCap is hosted at OHSU, all of the development, building, management, and maintenance falls on our non-research project team, which I am the lead of with support from our PI, Dr. Liz Waddell, as well as our research associate, Rose Gorin. So that said, you will be seeing me in the future. We've already trained more than 50 impacts personnel across 15 grantee sites on how to access and use this database, from setting it up to, how do you log in, really basic things, all the way to more advanced details about the code book, every single question and the definitions defined from there, and really meeting staff where they're at with their data entry experience. We do have some pretty cool advanced features in REDCap that we'll explore over time, but right now just getting everybody set up and oriented and making sure people know how to use it. A few quick highlights of our role. Our role as an OHSU PSU School of Public Health in overseeing this database moving forward. Really, we're going to be managing account operations, serving as the key point of contact for providing support. We'll be doing new staff training and onboarding, continued support for those who have already been trained through very many modalities. We already offer drop-in sessions, email support, one-to-one support. This is a big one, conducting regular data quality checks, including direct outreach to grantees at the close of each data collection period. So this is especially needed as we're getting everybody oriented to this as a new platform and as a new process for folks. So we can say, hey, grantee, we see you entered 15 records for the month of July. 5 are incomplete, 5 are unverified. Could you please confirm? And we can really have that one-on-one support and help to ensure that the quality is as good as we can get. And then finally, collecting grantee and stakeholder input and feedback to help inform improvements as needed and through time. And that's all I have today.
Thank you, Sarah. I really appreciate that overview. Are there any questions for Sarah before we move on? All right. Well, thank you again, Sarah. I super appreciate it. Move forward with our agenda here. Will, can you give me a nod if you see our agreement amendment request? Fantastic. Thank you. All right. So a quick refresher on this agreement amendment request review process. Approval from this GRC is needed when the amendment request exceeds 10% of a program's total grant award, or when the amendment request makes a substantive change to a program, a programmatic shift, if you will. Otherwise, request to reallocate any portion of grant funds that is 10% or less of that total grant amount may be administratively approved by CJC staff. So today, we will review one amendment request, and once I've presented the details, we will pause briefly for public comment before moving forward with discussion and action from the GRC. So The Klamath Tribes would like to reallocate $100,000 from contractual services to increase their recovery support supervisor position from 0.25 FTE to 0.75 FTE, which is approximately $50,000. Additionally, they would like to stand up a contingency management plan for clients with incentives for meeting goals and benchmarks related to the client's reentry and stabilization within the community, a little less than $50,000. These funds are coming from a dissolved contract with the Klamath Basin Behavioral Health Sobering Center, and this does not exceed 10% of Klamath Tribe's total grant award. However, it is a programmatic shift, which is why it is being brought before you today. The increase in FTE of this recovery support supervisor position would permit that individual to increase their time spent on the impacts program and with the impacts program population, as well as stand up, implement, and oversee a new contingency management plan. The plan is based on other tribal and evidence-based programs that provide incentives for participants meeting specific goals and benchmarks, which are created in conjunction with their case manager or peer support counselor and related to their reentry and stabilization within their community. Incentives could include larger gift items such as bikes, tribal regalia, toolboxes, etc. Benchmarks could include participations in groups that are like non-billable hours, cultural activities, prevention and recovery activities offered by Klamath Tribes, Klamath Tribal Health and Family Services, community support groups, participating in sports, going to a gym, attending classes, attending spiritual services, linking to educational or employment services, attending medical appointments. All this to say, there are so many ways to recognize and celebrate small successes during recovery. And as we learned this last year, through all of the different grantee interviews that OHSU's Waddell Research Group did, recognizing and celebrating those small successes really make a difference in these people's lives and their recovery process. In order to be eligible for these like weekly incentive, like raffle draws almost, clients must be engaged with the impacts program and are expected to keep a log of the qualifying activities that meet the goals that their case manager and their peer support supervisor have, set for them. They must obtain a signature or verification of their participation or achievement, and then submit their log to their case manager or peer support counselor to receive some sort of entry into these like little raffles. Let's see, are there any questions about this, before we pause for that public comment and action is taken?
This is Stacy Brubaker. I just wanted to say, contingency management is really a wonderful program. We see great outcomes with it, and I think totally support it and think that it's a good route to go to be able to help people stay engaged.
Thank you, Stacy. Dr. Brigham, I see your hands up too.
Yeah, I just had a question if there's any kind of, I don't know how many participants Klamath Tribes has in the program. And I was just curious if there are any caps on the amount that a single participant can receive.
Yeah, no, those are great questions. So they have identified like 167 eligible members for this. And of course, that could go up. It also could go down over time, especially before June 30th of next year. And the total like gift amount, like a monetary amount that is a maximum is $599. They can't exceed that $600 mark per person. And that's why these larger gift items are not necessarily like monetary value. They're not handing over cash. They're not handing over gift cards, running the risk of, tracking where those folks are spending that money. But yeah, that wouldn't really exceed that $599 amount. And does that answer your question?
Yes, thank you.
Yeah. Chair Flanders.
Thank you. I was wondering if there was any comment on the dissolved contract with the Sobering Center, if it wasn't being utilized or if the numbers just weren't there and this is a better approach to what they're trying to accomplish.
Yeah, absolutely. Thanks for that question. It's a little bit of both. And also, unfortunately, the contract was not renewed due to non-performance on Klamath Basin Behavioral Health Sobering Center's part. You know, I guess the one main reason is that they weren't seeing a lot of their tribal members go through the Sobering Center and utilizing the facility as they had thought, you know, would happen. But they also weren't receiving referrals from Klamath Basin Behavioral Health from the Sobering Center. And there were just other contractual obligations that were not met. So they decided back in July to not renew for this last year through June 30th, because they really thought that the services being provided and that were available were not beneficial to their program participants.
Great, thank you.
This is Janie. I'm sorry again with no raise hand feature. I feel rude. But, yeah, I was just wondering if, because I know there's a few contingency management programs launching across the state. So just wondering if this one is part of an additional wider contingency management effort, or if this is something that they're launching themselves. Again, I agree with what's been said. It shows a lot of promise, and I think, you know, this is a pretty great idea.
Yeah, no,
Just
that's a
wondering.
great question. So this is the tribe's effort, and it's, you know, to the best of my knowledge, not part of a larger tribal effort, you know, statewide or any sort of statewide effort. That was effort quite a few times. Sorry about that. However, that is the reason that they are looking to also increase the FTE of this recovery support supervisor position, so that this person can be dedicated to, you know, working out all the kinks and really standing up this contingency management plan and implementing it and making sure that the case managers and peer support specialists, you know, have guidance and someone to look to for any questions. But in my meeting with the tribes, they were well researched. I mean, gosh, they had lots of documentation of other contingency management plans that exist. They were working on some sort of worksheet, you know, to kind of really implement a policy of who's eligible, what needs to happen, a plan of attack for standing up this program, as well as the actual, you know, goal tracking sheets the case managers will use. So they were pretty excited about it, and it does seem to be their effort entirely, if that answers your question, Jeannie. Great. Dr. Britton.
Thank you.
Oh, you're on mute.
Sorry about that.
No
This is not really a question, but just an interest sparked by the previous question. So the Northwest Addiction Technology Transfer Center is working on a dissemination project of, you know, for this contingency management technology. That's generally, well, I don't want to talk about their pricing, but it's a public service. Anyway, they're doing a lot on very micro level sort of staff behaviors and that sort of thing that can increase the effectiveness. So it would just be feedback to the grantee that, you know, assuming this goes forward, they might want to reach out to the NWATTC to get support.
That's great to know. Thank you. I might need to connect with you after to get a little bit more information so I can pass it along to them. But, you know, I think we're all aware the more collaboration, the more evidence and tribal-based things that exist, the more success a program has. in terms of sustaining itself. So I think that's super valuable. Thank you, Dr. Brigham. Are there any further questions from the GRC before we pause for public comment and then move forward to any sort of further discussion and action? Great. So we'll now pause for public comment. If there's any member of the public on this call that wish to do so, please feel free to use the raise hand feature if you're on Teams for the video conference, or just hop on and say something. We, unmute if you're happy to join us by phone. Okay. Well, thank you everyone for sitting in silence with me for a bit. Just wanted to make sure we had ample time to navigate mute buttons and all the fun features of Teams. I'm not hearing anyone from the public that wish to make a comment, so we will go ahead and move forward with discussion and action. I'll turn it over to the co-chairs of the GRC for this part. And I guess before we go into this, Avery, if you don't mind confirming that we do indeed have quorum, that would be helpful.
Yes, we do still have quorum.
Okay, so I invite discussion amongst the GRC members, and yeah, we don't need any motions. We can, move forward with the general consensus, kind of like yay or nay voting later, but if there's any discussion.
I see Dr. Brigham has raised his hand. Go ahead.
I just wanted to add my support for the use of that technology, and it seems like to me a good redistribution of the resources for this project.
Thank you, Dr. Brigham. I agree. If there's nobody else, Casey, if you and Avery want to go ahead with a vote, that'd be great.
Yeah, if there's no further discussion or questions from the GRC, we will proceed to the vote. The decision before you now is whether or not you approve the agreement amendment request from Klamath Tribes that was just presented. Here, I will proceed to ask for those who abstain, those in favor, and those opposed. So first, are there any abstentions for this vote? Not seeing any, but I do want to recognize Dr. Brigham, your hand still raised. Was that an abstention or just a leftover?
Leftover.
All right. So all those in favor of approving the agreement amendment request for Klamath Tribes, please say aye.
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 Aye. All right. And those opposed say nay. All right, no oppositions. It passes. Thank you so much. I will now turn it over to Erica and Stephanie at OHSU Center for Health Systems Effectiveness to give us an update on the impacts baseline report. Erica, Stephanie, do you want to attempt to share your screen, or would you like me to throw up some slides?
I have them up, so let's
All right, great.
See what we can do here. And did that work?
It sure did.
Okay, cool. Hi, everyone. Thanks for having us here today. My name is Erica Simeon. I'm a policy analyst at the Center for Health Systems Effectiveness at OHSU. And I'm here with my colleague, Stephanie Renfro, who's our lead policy, or not policy, she's a lead quantitative analyst at CHSC. And we're just going to give a brief presentation on the statewide evaluation today. Whoops, next. Uh-oh. My slide did not, there we go. Excuse me. So today we're going to share what our role on the impacts project is, some key aspects of the statewide evaluation, and then also a preview of our baseline data, or some of our baseline data. So Stephanie and I, again, work for the Center for Health Systems Effectiveness, or CHSE, and we're an independent evaluator contracted by CJC to conduct this evaluation. And we are in close contact with CJC as well as the Waddell Research Group, who Sarah spoke earlier, who's doing the technical assistance and local evaluations. And we actually meet quite every 2 weeks to coordinate evaluation activities. And so the statewide evaluation is primarily quantitative. We'll excuse me, we will use administrative data from various state agencies to identify our target population and assess a variety of outcomes that will serve as indicators of the program's success. And we're also going to incorporate the local qualitative findings from the Waddell Research Group into the interpretation of our results in order to kind of gain a broader picture of program outcomes and successes. And for this evaluation, we're going to be aggregating grantee data. So it's not really feasible to make individual grantee comparisons because all of the programs are so different across the different grantees. So instead, we will be comparing results for all of the grantees in aggregate and comparing that to the rest of the state. And so just to give you a little visual here, this is a map that has the grantee regions shown in blue. So the statewide evaluation is going to assess whether individuals residing in impacts grantee regions will have improved outcomes relative to individuals with similar characteristics who reside in non-impacts regions. And so just a quick little overview, Impacts has the goals of reducing criminal justice system interactions, reducing high intensity healthcare utilization, as well as reducing institutional placements. So we will be calculating a broad array of outcomes in order to assess if Impacts is having an effect in these areas. And then next, I'm going to hand it over to Stephanie to do a deeper dive into that. And she's going to take you through how we will be using the data sources to measure these outcomes. And Stephanie, there you go.
Yeah, thanks, Erica. Hi, everybody. Nice to be with you this morning. This is going to be just a very high level overview. Happy to answer any questions, but we're kind of knowingly keeping it kind of high. So this slide shows you the data sources that are available to us for the statewide evaluation. You can see that we'll have Oregon Circuit Court filings, we'll have administrative data from the Department of Corrections, enrollment and claims data from Oregon Medicaid, and then Oregon State Hospital admission and discharge records. Collectively, these data will give us a really rich assortment of information so that we can measure outcomes, like Erica mentioned, that are within the impact focus domains of criminal justice and health. All of these data will be linked at the person level by Integrated Client Services, which is a shared resource between the Oregon Department of Human Services and OHA. The evaluation data set will be stripped of identifiers like names and birth dates, since we don't need those for the evaluation. It's just having that member level that's really critical. Thanks, Erica. Go ahead and go to the next slide. So for the statewide evaluation, our target population will include individuals who meet any of the bulleted criteria that you see here in a 6-month period. And we'll be reassessing the target population every 6 months since people can come in and out of it over time. And so those criteria include having 2 or more ED visits or hospitalizations with a primary diagnosis of a behavioral health condition, or 2 or more circuit court filings and a behavioral health diagnosis during the study period, or members that are released from community supervision or actively on parole or probation and also have a behavioral health diagnosis during the study period, or finally, individuals that are discharged from the Oregon State Hospital. We know that there's variation among grantees and how target populations are defined. Sarah alluded to that earlier. You all have probably heard about that too. And we know that some grantees have reported difficulty in obtaining the data that they need to identify their target populations. For the statewide evaluation, our definition takes advantage of the data sources that we have available, and it aims to be inclusive of the broader population that is served by the variety of impacts programs that are out there. Next slide, please, Erica. So now I'm going to share just a teaser of some of the findings in our baseline report. This report will be released next month, so we welcome you all to take a look at it when it comes out. I'm going to focus less on the results today. What I really want you to take away more than anything else is just the fact that we have these data. So all those data sources that we listed, they have already been obtained, they have been aggregated and linked. And that with all these data sources together, it's really able to help inform us about the composition of the impacts target population and to understand how these individuals interact with the health and criminal justice systems. I know there were some questions earlier about, the aid and assist population and where they go, and if that could be related to intellectual and developmental disabilities. With the range of data we have, those are questions that will be able to help assist the impact staff at CJC answer those kinds of things. So we welcome all of your questions that will help give us ideas as we proceed with the evaluation. And so in the previous slide, I showed the 4 criteria that are used to identify the target population. What you're looking at here is, so among members with a behavioral health diagnosis, these are the criteria that they met in order to be included in the target population during our baseline period. So right now we're looking just at the 2018 baseline group. And so you can see here, nearly half of the target population was identified on the basis of having 2 or more ED or hospital visits for behavioral health diagnosis. Nearly a quarter based on having 2 or more circuit court filings and a behavioral health diagnosis. And then as you kind of move right through the tail, you'll see that there are members also that have combinations of the criteria. Go ahead and move to the next slide. Thanks, Erica. Our baseline report will characterize the impacts target population by demographics, healthcare utilization, criminal justice interaction, and so on. This slide actually builds really nicely on one of the results that Will shared earlier. He shared how the grantees were reporting the top 3 behavioral health conditions for their members, and then how many members had those. We're able to see kind of the whole spectrum of behavioral health diagnoses based on the Oregon Medicaid data that we have. And so what you're looking at with this figure is the total number of diagnosed behavioral health conditions among individuals in the 2018 baseline target population. You'll see only 1 in 10, so that 11% figure, have a single behavioral health diagnosis in the data. A full quarter have 8 or more, right? And so this just offers a sense of the medical complexity of the population being served. So this in the previous slide kind of gets at what the target population looks like at a very high level. Our next few figures, we're going to look at some of the high level outcomes that span sectors. So if you could move to the next figure, Erica, thanks. So this diagram, it illustrates the way that individuals interact with the criminal justice system over time. And so I'm going to walk you through what you're looking at here. If you start on the left, we begin with anybody who had a conviction in 2018. And then as you move right, you can observe how they flow through the system. So we offer quarterly snapshots through the subsequent calendar year, so through 2019. You'll see that just under half of individuals that were convicted of a crime in 2018 had no further criminal justice involvement in 2019. A large portion are under community supervision. That's that kind of green bar along the bottom. And that includes prison, jail, parole, and probation. You see a smaller number that received new convictions in 2019. So that's that kind of second level down, kind of orangish color. And then also a small number receiving that are admitted or discharged from the Oregon State Hospital. I see a question from Janie, and I'm happy to take it.
I think it may have just been her popping back in. Janie, did you have a question? Okay.
Okay, I'll keep going then. Happy to be interrupted though. And so as we continue to evaluate impacts through the successive grant cycles, we'll be able to continue to observe these patterns and see how that flow changes. All right. Thank you, Erica. And so the last teaser that we'll have here is looking at a smaller cohort of individuals who were discharged from the Oregon State Hospital in 2018. And then in the following year, 2019, we measured outcomes for those folks. You can see here that more than a half of individuals discharged from the state hospital had an ED visit in the following year, and that's at least one ED visit. Some of them had many. Over a quarter had a hospital stay. Another quarter were readmitted to the state hospital in the following year. And then a small percentage had new conviction or had convictions and or entered community corrections supervision in the following year. And I'd stress this is a really simple bar chart. We've all seen bar charts, but underlying this is the fact that we have these huge linked administrative data sets. They come from across state agencies and across sectors. So there's really a lot here that kind of belies the chart. And so I hope these get you as excited about the potential from statewide evaluation as we all feel. We feel really lucky to be doing what we're doing. And with that, moving forward, we are on track to release our baseline report next month. So stay tuned for that, please. And our intent, funding permitted, is to continue aggregating these data sets, collecting more over time, and conducting a formal evaluation of each impacts grant cycle. So you can see here when you might anticipate those. In the baseline report, what that contains really is just a descriptive characterization of the population and service utilization just prior to the start of impacts. What you would get from the subsequent evaluations is a robust statistical analysis that is able to speak to the effects of the impacts program on a broad set of outcomes. And so that's where we're doing what Erica said, really taking outcomes for the impacts population and comparing them to outcomes of individuals not served by impacts programs. And with that, happy to take any questions that you might have.
I'm not seeing any questions coming up. Thank you both so much for being here. I'm so excited for that report to come out in September, and we'll be sure to share it with the GRC. So keep an eye on your inbox for that. And I just wanted to recognize all of the effort that Stephanie and Erica have put into this baseline report over the last, 2 years. And how much patience they had in setting up data use agreements and with all of these different statewide, administrative data sources. And thank you both for all your efforts in getting this going. And we're excited to see where it can go next. Great. Well, I will get back to the slides and pass it over to Ken before getting into our impacts funding considerations.
Thanks, Casey. I just have a couple little remarks I'd like to make. First, I want to make sure to thank Stephanie, Erica, and then Sarah earlier as well. I mean, it is truly exciting to see the little tip of the iceberg of results we're beginning to get, even just at the descriptive level. And I think I agree with you, Casey, that a lot of the questions that we were wondering about as a GRC earlier when it comes to outcomes and just, how do we prove up impacts and how do we make sure we're having an impact with impacts? This is the way we're going to be able to do that. And it takes a long time to get these set up. Again, yes, kudos to Stephanie and her staff for dealing with all of the red tape. But, this is truly an asset that we have both just within the impacts program, but then within the state of Oregon as a whole. Stephanie's team and then the Waddell group, I mean, they're just powerhouse, researchers, and we're really lucky to have them with us. So I just wanted to mention that. But then also I wanted to thank many of you who are on this call right now. As Casey mentioned at the beginning of the meeting, and as hopefully you all knew, we were able to secure another $10 million in funding for this biennium for impacts. And I really believe that that could not have been done without the outpouring of support that we had at our budget hearing, meetings and conversations that many of you had with legislators. And then also, I think that the retreat that I know that most of the GRC were not participating in, but the retreat that we had in Seaside, we had folks from the governor's office attend that as well. And I think that all of this, the testimony, the grantees discussing the types of programs they're running and the gaps that they're filling that otherwise would have people falling through the cracks within our system, all of that contributed to gaining more money for this biennium. And so I want to make sure to thank all of you who testified, especially and had conversations. We are hoping to continue to have conversations about getting more secured funding. I don't like the roller coaster of waiting to the end of every session to see if we can get $10 million in the end of session bill. And so that's something that CJC staff is working on in the background as we try to approach the next long session. But again, just wanted to thank everybody for your dedication, for the enthusiasm that you were able to communicate to our funders. And, let's continue to make impacts the great program that it is. And hopefully next time we'll be talking about a more secured funding stream as opposed to kind of where we're at today. But thank you for all the effort you've put in.
Thank you, Ken. All right. So, just to piggyback off of what Ken said, it's so exciting to have this additional appropriation of money. These funding considerations are incredibly important, and there are tough conversations to have, and it's difficult to make priorities. And I just want to acknowledge that these are big things that we're talking about, especially when we remember that these funding decisions affect people's lives. And we are today just going to give you a very high level overview of the available impacts funding and considerations as to where we might go next. No action on funding decisions will be taken today. Rather, I'm really hoping to gain some guidance from the GRC as to which funding scenarios you want to take a deep dive into come the November meeting, in which we will be taking action regarding funding for future investments in impacts. So with that being said, I'll go to the overview of available funding. So we have the $10 million recent appropriation from the 2023 legislative session, technically for use in the 23 to 25 biennium. There's a little minus $300,000, and this is just a reminder, a little flag rather, that 3% of that appropriation is statutorily required to support outcome measures and/or evaluation. So we're just dog-earing that for now, reminding that really there's $9.7 million of new funding available to go to any type of investment, be it sustaining programs, new programs, engagement, diversity, inclusion, and cultural responsiveness, more data support, and evaluation. So many different things to consider. We'll get into those in a bit. We also have approximately $1.4 million that remains unallocated from the previous grant cycle. Total that we're looking at, knowing that $300,000 will be going to some sort of, outcome measure and evaluation. You all will need to decide that when the time comes in November of where that will go specifically. But in terms of new funding that's available to invest in any sort of priority or funding scenario, we're looking at around $11 million, $11.1 million and change. So here, I'd like to share some considerations. Some of these you may recognize from past GRC meetings, past conversations, and some are just, present considerations that we threw in there. So these are for you all to contemplate today. I have slides prepared that will follow this overview, and they will take us into each of these considerations a little bit further. And as a reminder, no action will be taken today. We can definitely have discussions. General consensus as to what you guys would like to see in November would be really helpful. But as we go through these next slides, I really like the GRC to consider to what extent would we want to prioritize certain funding. So some of our options here, existing infrastructure required for grant maintenance. We heard about that REDCap database, and data capture is instrumental in showing efficacy of these programs. Speaking of program efficacy, research and evaluation of impacts programs, like Stephanie and Erica just presented for the statewide evaluation. Engagement in diversity, inclusion, and cultural responsiveness. That is something that this GRC thought to be very important at the end of last year. And, we're looking to in what ways we could bring that into the conversation. We currently have 15 impacts grant programs who are funded through June 30th of 2024. So less than a year from now are the project periods that are funded for our current 15 grant programs. There's an option to open it up and invite new programs through a new request for grant proposal. Also thought we could consider maybe some sort of iteration of a replication of the 2022 application cycle process. So we will dive into these and these next couple of slides. But yeah, so sorry to sound like a broken record here, but no motions are needed, no action will be taken. Discussion is completely welcome. Please feel free to ask questions and weigh in. And also let me know if there are other things and other priorities and other funding scenarios that you would like to see that maybe you're not seeing on my slides today. So we're open. We're excited to talk. Ken.
So Casey, I was going to suggest maybe we pause just for a moment to see if folks have any initial thoughts before we dive in too deeply, because once we get into the weeds, it might be hard to get back out again. So I'm not sure if folks have any initial thoughts on, priorities, ideas, or even, including a research angle, maybe above and beyond the 300,000 minimum. But just, yeah, any thoughts that folks have might be good before we move on too far.
Stacy.
I was just going to ask, is there room for a combination of these things? It's not like we have to do just one or the other, right? We could figure out if we wanted to break those dollars down and give certain amounts to certain efforts.
Oh, absolutely. And that's kind of that, if we're looking at it in the pie, what slice might research and evaluation get? What slice might supporting grantees get? Definitely, these dollars can be split up in any way that you all choose. And that's what I'm hoping to kind of get some clarity on today, so that in November, I can bring to this GRC different funding scenarios, different slices of that pie to consider, and to really reflect the priorities that you all have in seeing this impacts grant move forward.
So the thing I would just add is I think right now there are some winners and some losers around the state. And if you look at that map, I think that there's still some opportunities for us to spread the good work of impacts, and realizing that sustainability is a big piece as well. But I just think right now there's some winners and some losers across the state that I think we do need to consider inviting potentially new programs to apply.
And just to clarify, in terms of like the winners and losers across the state, is that in reference to the existing grantees?
Yeah, and just the communities benefit from the impacts dollars that aren't seen across the state.
Okay.
And I think that's a very helpful comment. And I see Dr. Brigham has his hand up too. I think a lot of what would be nice for us as staff to get today is, if there's consensus, either that something should be prioritized, or maybe there's consensus that something we just don't have, the funds to cover. That will really help Casey and her team to develop some scenarios for November. So even if it's just a thumbs up or thumbs down for different ideas, especially as we go through the conversation, please don't hesitate, folks, to kind of weigh in so that Casey doesn't both waste her time or waste our time next time with a bunch of scenarios if it's like, well, we never really thought we'd want to do that thing anyway. So that would be very helpful. But I'll turn it over to Dr. Brigham.
Thanks. So I wanted to comment that it would be nice to know as we go forward and get into decision-making mode, a little more data, like how much resources needed to sustain the evaluation efforts that have already been started and the infrastructure that's listed here. I mean, how does that compare with the 3% minimum set aside for that effort? Like how much more would be needed to just continue the work that's been done so far and then to expand on it? Also, if we were looking at sustaining existing programs, it seems like we might want to at least consider some form of competitive process where we would look at the performance of the projects and, whether I don't have a good aggregate feel for, how each program is done, but I know over time we've reviewed programs that were having challenges just with basic implementation, just, getting the staff that they needed or implementing the program and so on. So it seems like rather than taking some standard approach to everyone or blanket approach, we might want to look at a little more competitive process, or even if it's not competitive, something based on performance, some kind of review of whether the program is actually happening and potentially having an impact. And then I think to the previous comment, having some opportunity for new programs, some kind of RFP or something seems desirable.
Yeah, those are all really helpful comments. I think that Casey does have some estimates on the research angle, and so we can discuss that today too to get a flavor for that. But I like the suggestion. I mean, maybe it's even just including from the grantee's point of view, what progress have they made and what performance do they have in the application process if we want to try to do a little bit more of an evaluation. Because I don't think we have the capacity or the data yet to do one in, ourselves, but at least we could see and try to capture who might be having some of those struggles. I think we can see that in the grantee spending as well a little bit, and so we might be able to discuss that. I'm not sure if we have that today, but we might be able to discuss that in November.
Yeah, this was kind of a tight turnaround to prepare for this meeting, to be quite frank, just because we learned at the very end of June about this new funding, and the idea of bringing, totally fleshed out considerations for you all to vote on today was pretty daunting. So I appreciate you guys, deliberating and having conversation and identifying priorities so that we could prep for November. That's very helpful to me and my team. To answer your question, Dr. Brigham, we, also gave the research teams, OHSU, PSU School of Public Health, the Waddell group that's doing the REDCap database support and all of the individual grantee technical assistance, as well as the OHSU Center for Health Systems Effectiveness team that's doing the statewide evaluation that is just wrapping up their baseline report. A very quick opportunity like, hey, we're meeting with the GRC at the end of August. What might it cost? Estimates. You don't have to give us a full proposal at this time, but it well exceeded $300,000, and in fact, it was near $2 million for that sort of investment. And to really be level with you all in this moment, sustaining current programs at their pass for grant requests for their total funding, investing in, data support and continued evaluation, thinking about engagement, diversity, inclusion, cultural responsiveness, we blow right past that available amount of funding. It's not sufficient to do everything at full capacity. So that is why, having discussions today about what type of funding scenarios you all might see, what really are the core priorities that the GRC wants to identify, are so crucial to preparing for November. I have a couple of slides prepared that we can go through, maybe spur up some more conversation. Please stop me at any point if we want to talk about this further. We'll circle back to this overview of funding consideration slide after we go through each of these bullet items. We can also stop sharing the screen at that time and we can just, talk face to face, have a discussion. But I think I'll go ahead and start ticking off the slides if that's okay with you, Ken. Yeah, okay, cool. So in terms of supporting that existing infrastructure, we have this REDCap database. Sarah, walked us through that earlier today. The Waddell Research Group recently developed that tool. It's been in the process for, a long time. It was rolled out July 1st of this year. Grantees are just dipping their toes into using it and seeing what can come of it. They're in the middle of equal parts, excitement, and there's questions, and it's an open feedback loop between the grantees and the Waddell Research Group. So it's a really exciting opportunity to think about this client level data that we're going to be able to see and the outcomes that we will be able to look at. Especially, we're hoping to have a more detailed preview of what this looks like for this last quarter at the November meeting for you all to consider and learn. So in terms of the REDCap database, it's instrumental to impacts, and I am not sure what it would look like if we did not support this existing data infrastructure. So one consideration for you all is to, extend the contract with the Waddell Research Group through the end of whatever the next project period is. And that's another thing we'll talk about soon. Or do we have enough funding to go for 2 whole years? We want to consider going for just one and figuring out sustainable funding in the background. So, more things for you to think about. But their existing contract and the scope of work that they will expand on with the implementation of this REDCap database includes maintaining that database, providing technical assistance to grantees for that data collection and reporting, implementing updates based on those quality assessments, those quality data checks that they're doing every month, incorporating grantee feedback. They are going to report on those impacts local evaluation results. They'll share that monthly with the CJC. They're going to continue to conduct qualitative interviews and or focus groups with grantees to ensure that, outside of that data, are there things that we're not capturing? Is there stuff we need to incorporate in data, or, that very important narrative reporting? But qualitative is very important to showing the efficacy of this program. And then disseminating local evaluation reports, convening grantees for webinars, and hopefully another in-person retreat at some point, submitting conference and manuscript abstracts. So their very quick turnaround proposal was around $600,000 for 2 more years of continuing this support of the existing infrastructure, and then the items outlined here. That could change a little bit before November when we ask them to flesh out a full proposal. But if there's something that you see here that maybe you're not interested in at all, that would be really helpful to know, or something that you think maybe this team, you'd like to see them do or could be doing, that would be also helpful to know. So another consideration is this research and evaluation of impacts program efficacy. So this is what Stephanie and Erica, the team at OHSU CHSE, touched on earlier. They are just about to complete the baseline report. And as they mentioned, that covers pre-impacts implementation. So that's before the grant even rolled out in July of 2020. They have, so that's the funded work product that we all actually funded, I think in the last grant cycle, was that baseline report. Their original proposed work products included a grant cycle 1 evaluation and a grant cycle 2 evaluation. And that's, as Stephanie mentioned, somewhere that you can really get into analysis of impacts client outcomes versus non-impacts client outcomes, that comparison showing, is there a difference using all of those statewide administrative data sources and all of the, complicated linking and the amazing analysis that those gals do. And then if we were to have a third grant cycle of some sort, perhaps also a grant cycle 3 evaluation, depending on how many years that is, we could figure that out in the future. But each report here is, about $440-ish thousand. So that's nearly $900,000 for the grant cycle 1 and grant cycle 2 report. If you want all three, that's like a $1.3-ish million investment. And again, we'll get these numbers completely fleshed out ahead of November for you all to actually consider, but wanted to give you some sort of ballpark idea so that you understood what this pie of available funding looks like, and what we need to consider in terms of prioritization. Are there any questions about this before we move on to the next bullet point? All right. So this, I am circling back to something that we talked about a lot last year. We included some questions in the 2022 grant cycle RFGP and short form applications for existing grantees. How do we engage diversity, inclusion, and cultural responsiveness as part of this grant program? Some of the ideas that the grant review committee had towards the end of last year was a non-competitive, low barrier funding formula through which grantees could choose to opt in for a set amount of funding to engage in diversity, inclusion, and cultural responsiveness efforts, such as identifying the communities they serve, determining gaps in inclusivity, enhancing culturally responsive services, receiving specialized training, and any other efforts that you all decide. We were considering basically a menu of options, maybe a set amount of funding. Maybe it's, I don't know, throwing a number out. Maybe it's $5,000. Maybe you as an impacts grantee could choose to opt in for $5,000 to be used for one of these menu options to engage in diversity, inclusion, and cultural responsiveness. And then maybe we have some sort of report back to us, some sort of evaluation afterward. Those are just ideas, but this is what we were talking about in November of last year, if any of you recall, and one of the considerations on the table for future impacts funding investments. Are there any questions or comments about this before we move on to the next data point? All right. So supporting existing programs. This has all been a priority of yours from the beginning, ever since we had our second grant cycle. So there are several different ways that you could slice this, and I'm talking, dozens and dozens of funding scenarios, but many of them come very close to using the total amount of funding available, that $11.1 million, or they exceed it entirely. So as we think about supporting these existing programs, the question arises, to what extent do we want to do so? And to what extent are we able to do so? There isn't really sufficient funding to roll them through the next 2 years based on their previous requests for funding. Even if no data investments or infrastructure to the REDCap database were supported at all, that exceeds that $11.1 million. However, there may be other ways to sustain current service levels while leaving maybe even room for capacity building and expanded scopes of work that have been at the top of many grantees' minds over the past year of like, hey, we have a program, it's going really well, we sure could use a little more funding to do this thing. So, do we want to slice this based on their previous grant award, some portion of that, maybe their estimated current service level, like maybe we have the grantees tell us, hey, here's what we would need to get through this date. Do we want to do it on the average rate of spending? That's another consideration. Our original grantees, if you will, the 11 that started in 2020, should be at about 75% spent at this point in time. And our new grantees, the 4 that were added last year, that are in the very first year of their implementation and standing up their programs, should be at about 50% of their funding of their 2-year grant cycle. So, keeping in mind that those are a little bit different, maybe we look at, hey, how much have they spent of that 75 or respective 50%? If it's, if they're right at that level, maybe they need full funding to keep going. If they're grossly underspent, maybe they don't need, a much additional funding. And that might all sound very familiar to you regarding the carryover exercise that we had grantees go through, the existing original 11 grantees last year. We had them estimate how much money they would need to get through another 2-year grant cycle. Then we had them estimate how much money they might have left of their existing award. And we took the difference, and that was the maximum award that those folks received. Before I get into these bullet points, Dr. Brigham, was there something that you wanted to throw out for conversation?
Yeah, I mean, it's just been on my mind as you've been going through the slides, our original kind of review of proposals and our implementation process. We had set there was a target population for the project from the beginning. And I think, was it 4 bookings in a year and some high cost engagement in the healthcare system. When we actually got into reviewing and making, recommendations on awards, we ended up in this sort of let a thousand flowers bloom kind of thing. We weren't tight on that stuff. There was a range of how closely those target populations lined up with the original description of the intent. And also, a wide range of approaches. And some were enhancements of existing programs, some were start from the beginning kinds of things. And we tried to encourage a wide range of that. It seems like at some point, though, we need to dive back into a deep discussion about the program. And, again, I felt like there was a premise back then that these were going to be like demonstration projects. We're going to see, well, what does work? And by work, I thought we would mean have an effect on the target population. So, fewer bookings, less healthcare, preventable healthcare expense, and so on. So I know we're early in some of our evaluation efforts, and so we're limited by that, but that's just on my mind as you're talking, Casey, that this is a discussion we really, I think, should jump back in and have in a deep and thorough way again, to ask ourselves if we are on track and if we are, doing what we originally intended to do. And I don't, I don't feel like I have a firm answer to that. I know we've monitored a lot of kind of process variables like implementation and, burn rate on the money and, things like that aren't really the outcome. So anyway, those are just my thoughts as you're going through this.
Yeah, thank you for sharing. Ken, do you have a comment?
Yeah, I'll just jump in and say, Dr. Brigham, I agree with you that we probably should have a deeper discussion about that. I mean, I think one thing that we learned is that initial point of looking at 4 bookings once we got into COVID was just untenable with the way that jail and practices changed during COVID. But I think they've also changed so much since that study that we relied on pre-COVID probably is not valid today. And so I think that you're right. We gave them a lot of flexibility, but maybe we do need to try to talk about some touchstones in this new era, and try to go from there. I think we've done a lot with our research partners that could help us to both define those outcomes and then also measure them going forward. So I think it could be a good conversation with them as well. One thing I'll mention though about, yes, we cast the net very wide. We let programs really kind of shape themselves. But one thing that we've been working on internally is looking at some empirical ways of being able to define and bin and break down the types of programs that we have. And so that's something we can add to the, which sounds simple in one way, right? Like we know kind of our programs, but at the same time, when you really want to look at 25, 30 different characteristics of programs and then empirically connect all the programs together, it becomes a little bit more complicated, and sometimes it confirms what you already know, but then sometimes it shows some commonalities we didn't know were there. And so I think that'd be a good thing to put on the agenda, at least briefly, for our next meeting, so we can talk about what we have, because I think that might inform us that if we're looking for whether it's new programs or whether we're having programs kind of talk about what they've been doing and how they fit into the impacts, kind of the impacts umbrella. We could maybe track some and say, there's a law enforcement, kind of lead style diversion track. There's more of a behavioral health, primary run, track. And so we could actually do that if we'd like to. It would also help us in our conversations with funders if we're trying to set something up that's more sustainable and expand and talk about which programs are working and what kind of offerings we could have. So I really appreciate that comment. Maybe it means that November needs to be a longer meeting if we're trying to talk about some of those foundational pieces. But I think we've actually got some of the ingredients there to talk about them, and staff has been working behind the scenes to make it so that could be an easier conversation, and it's not just all of us trying to think the best we can about the programs we know and how they all fit together.
Thank you both. Yeah, I'm happy to dive into a little bit of those commonalities discussions that we've been looking at internally in November. And yeah, well, I will start to gauge interest about making it maybe another hour at least for a lot of these important discussions, and then also decisions regarding funding. And then this a comment I wanted to make, Dr. Brigham, was that the 4 more bookings on that target population was definitely part of the original grant intent. And as Ken mentioned, COVID really made that look very different, and it continues to look different today. However, there was this option. It was, hey, must have a behavioral health condition and 4 more bookings, or a behavioral health condition and be a high utilizer of emergency healthcare resources, criminal justice system. And that has actually been very interesting, I guess, to both the behavioral health workforce and the law enforcement workforce, as I've met with grantees over the past 2 years. Law enforcement calls and responding to calls, it takes a lot of resource, and time and money to get out there. Someone coming into the emergency room. I remember Alicia Beamer shared with the CJC team earlier this year some fascinating info on how much it costs just to see a doctor in the ED, and what time that takes, and how valuable it could be if those persons were diverted from that. So high utilizers definitely look different in each community. I know that we had some tribes say that if someone had 2 or more bookings, in a 1-year period, they were removed and in prison. They were no longer even available in the community. And how can we divert folks from getting there at an earlier stage? So I think diving into that conversation a bit more in November would be really helpful, and I'll try to prepare something for that. So thank you for bringing it up. Back to this current slide for the bullet points, considering outliers, I think is really important. As I mentioned, we had those 4 new grantees. They're at a different stage than the 11 other grantees that started in 2020. And maybe giving them a little bit of grace as to not having full data available or at full impact of their impact program. Maybe that is something that we want to consider as we move forward, that they look different. If spending is concerned, that's also a consideration for those new folks. And if previous grant awards are considered, especially for the 11 original grantees, those looked very different year to year, depending on spending, all of the hiring challenges that folks faced in 2020 and 2021 and continue to face, quite frankly. But I remember there was one particular grantee who had such hiring challenges that they didn't ask for any additional award in this current grant cycle, but now they have someone on board and they're fully spending, what they do have. So things look very different from grant cycle to grant cycle. Considering 1 or 2 more years of additional project period would be interesting. For folks, things have changed in terms of rising costs. Maybe we would want to consider some sort of percentage increase for, sustainability of programs, not to just give them what exactly they asked, for previously, but if it was based on a previous grant award, we might consider, increasing it by some sort of percentage. Again, the requests for capacity building and expanded scopes of work for existing programs. We've had some, very squeaky wheels requesting some oil, hey, like we have these great ideas, we want to expand. So that should be a consideration. And then the possible carryover exercise in 2022. Let's see. In terms of a new request for grant proposals and, what Stacy mentioned earlier about opportunities to spread this amazing work elsewhere. I see that value, and I have a map of Oregon behind me. There's a map here, and I know that there's those blank spaces where impacts is not yet, and it's striking, especially thinking about the rural area of southeastern Oregon. What would it look like to have a program there? My opinion right now, at least without doing all the math, but I'm just not sure if we'll have enough funding. And so maybe that's something that we keep as a top priority. And as Ken mentioned, maybe we internally look at how do we get this to be sustainable and maybe at a higher dollar amount so that we can expand statewide, because Dr. Brigham was correct too. These were intended to be pilot programs, looking, for a while and learning the efficacy of these programs. And then maybe we hone in on those best practices and make it a bit more competitive. These are all things that we want to think about. So if we did do a new RFGP, maybe the grant review committee would create certain priorities or areas of focus that they really want to see. For the record, the average amount of grant funding requested per program, $837,000-ish. That obviously depends wildly, depending if it was in a rural community or if it was, in the I-5 corridor. It varied among tribal and county governments. So lots of things to consider, at least with that point. The replication of last year's grant cycle process might be an interesting consideration, that carryover exercise. Maybe we do identify some priorities. There's a lot of different things. So I realize that we only have 2 minutes left of this scheduled meeting. But I've written down at least what has been said so far, but are there any other comments that folks want to make to guide me in preparing these funding scenarios. Or to what extent we want to prioritize sustaining funding, research and evaluation, infrastructure. Is there any general consensus on an interest in sustaining current programs? At some degree.
I would say with a caveat of my own potential conflict of interest that yes, I am very interested in that, but with the caveat that, you know, I think that we need to look at the original intent that, you know, is it having the impact that was, you know, we should have some evaluation of the programs and not just, I think, just do a, you know, pro forma kind of approval of all programs because they're existing.
Janie?
And I appreciate the evaluation and the data component, because as one of my friends and colleagues says, if a tree falls in the forest and we're not, we don't see it, did it fall? So just that tells the story, right, broadly of how Impacts is doing. And then, you know, I agree with what's been shared with evaluation of individual grantees and programs, but also with the thought maybe that those that have struggled, could there be an offer of TA in a way that could support course correction or innovation if that needed to happen, to then bring it back around to the same goals as Impacts funding, if that's straight at all, or if there were other kinds of struggles.
Thanks, Janie. Well, I want to be mindful of everyone's time, but I think what this is looking like, you know, I will prepare different funding scenarios for you all to consider in November. I'll try to definitely get that out a couple weeks in advance for the GRC to think about and review. You know, some sort of evaluation component maybe to the existing grantees as to performance and you know, impact, for lack of a better word. The importance of the supporting existing data capture and evaluation to continue to learn about program efficacy, but then also demonstrate that to the legislature in terms of maybe securing some sustainable funding in the future. I think that could be vitally important. So I will do my best to get those together for you all in November. Our meeting is on Tuesday, November 14th, currently from 1 to 3 p.m. I will be reaching out to you all to see about maybe extending that a little bit and what possibility we have to get that meeting together. But thank you for being here today. Are there any questions before we sign off? Great. Well, thank you all again for being here today. I really appreciate it, and take care. Have a lovely day.
Thank you, Casey.
Thank you.